Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning in today. Today, I am joined by my next guest, Dr. Ahunna Freeman. Thank you so much for being here, Ahunna.
Thank you for having me, Brandy. I'm so excited to be here with you.
I am so excited for this conversation. And before we get started, I want you to introduce yourself to the audience.
Of course. So I'm Dr. Ahunna Freeman. I am a clinical pharmacist, a pharmacy owner, and I also consult with healthcare providers that work in community practices.
So let's talk about your journey. How did you get here to being a clinical pharmacist and, ultimately owning your own business?
Oh boy, Brandy. Well, I was born and raised in Nigeria. I moved here to the US with my family when I was in high school. So from a Nigerian background, my family are really big into education. So I knew I was going to do something in the healthcare field. And I began that journey at UNC Asheville with chemistry background, and then moved on to Campbell University for my Doctor of Pharmacy degree. So upon graduation, I started working at one of the retail big box chains. And from then on, I knew I was supposed to be doing more because honestly, the pharmacy profession really prepares you for a lot of clinical work. But coming out as a practicing pharmacist, I didn't feel like I was really doing all that. And whenever I had to stop, I take the moment to explain things to my patients or to providers that needed help with navigating patient care. It was taking too long and it was putting us behind at work. So I had to just make the decision to figure out something so I can make sure that I'm still getting the joy in pharmacy and being empowering to others, the patients and the providers that are all into patient care.
Yeah, I've heard many pharmacists share that pharmacy is hard and it's so black and white. There's so many, you have to get it right because of the work that you do. And it's especially hard in retail pharmacy because there aren't that many pharmacists. And so you're working under the time constraints, the pressures. Can you talk a little bit about that?
Oh, yeah, that definitely. You have that correct. And retail pharmacy really embodies all of what you just said. There's a lot of time constraint, but in reality, it's not just pharmacists that are facing that in healthcare. And it took me a while to understand that. And while I was working in one of the chain, I never really saw the other side of patient care. I only saw the pharmacy side, and it was all about the metrics. It was all about moving, and, just so much going on. And it just wasn't conducive to the real patient care.
Yeah. So how did you, or what prompted you to switch from retail pharmacy into doing something different?
Well, I just knew there were more to patient care than just filling prescriptions, counting and putting the bottle, checking for interactions. So I decided that it was time, especially when children came into the picture, into my life, with being a mom. You really have to think of the time that you have and how you can use your time wisely while you're here on earth. So being at work, working long hours, coming home to kids already in bed, and the next day leaving before the kids are up, it was really taking a toll on me mentally.
Mm-hmm.
Yes. So that decision is really what helped me make it. Like, I have to find a better way to still provide the patient care, still bring value to a community of patients and healthcare providers without sacrificing who I was. No, and it wasn't an easy because, your audience are probably thinking, well, not everyone can do this. And that is true because there's a lot of financial implications that come with this decision. And it's just about believing and putting together the business plan, and someone out there will believe in you and give you the support that you need.
Was that your defining point? Was it when you had children, or was it at another point in your career?
Well, the decision to pivot into independent pharmacy as an owner, become an owner, that was the defining point. My second child was the defining point because going back was something I could not endure, living the life I lived after my first child. So I had to make that, my husband and I, we had to make that decision.
And I love what you do because part of my belief in our U.S. healthcare system is the best way to fix our healthcare system is not to need it. And the work that you do with preventive care is inspiring to me. So can you talk about what you do with in your business and towards preventive care specifically?
Absolutely. This is the part that really brings me joy because I would preach on top of the world about preventive care. As a pharmacist, we're used to, well, patients or the community are used to seeing a pharmacist and thinking, okay, we're going to get a new medication, or what medication is she going to talk about? But the truth is, the goal really is to help patients not to need those medications. And if they actually do need the medications, we want them to use it safely. And it takes everyone to be involved for that to happen. And it's not just the pharmacist, it also includes the providers that are caring for the patient. It includes the caregiver that's caring for the patient and the patient itself. So with preventive care, I take that very seriously in my pharmacy. I left the big chain to do that pharmacy, and with hopes of building a clinical community pharmacy where patients in the community can actually come to receive information that they need, get educated on all things medication. And I also use the same mantra when I talk to collaborating providers that I now consult with or that consult with me, because it's not really just about medications. There's more to pharmacy and more to patient care with medication that's just adding on another medication, if that makes sense.
So is it direct access? So can a patient come directly to you, or would they have come to you because they have some sort of prescription from their medical doctor?
Oh, patients would directly come to me, and patients actually would come to me from just word of mouth from someone else. Community patients or people in the community, really, when they think of pharmacies, they're thinking the big chains. They always think at least in my community, they think the independents, that there's something special, maybe a membership, or, if they're taking in new patients for some reason, I don't know. But no, they really would come to us because someone else told them, oh, you're having that problem, you should really call Ahunna, you should call this number or go by that place. And a lot of times they come just when they have issues. And it's really not issues. It's just something that just needs to take time to sort out.
Yeah, well, there's this huge stigma, I would say, with big pharma and the cost of prescriptions and where all the money is going and how is it really benefiting the patient. What are your thoughts about all of that?
Well, I always look at it this way. There's always an agenda that we may or may not know about, but really it's not our place to be the detective of that, because honestly, as it stands right now with big pharma, there's no transparency.
Mm-hmm.
There's none. And for me personally, because this is very objective, or this is very subjective, for me personally, I have to focus on what's best for my patients. and not just what's out there or what should be happening, because everyone is different. And I don't know what the big pharma has in place. Like, I don't know their plans, but I can't spend my time trying to understand that.
Yeah, I mean, that's a good point. So what do you think would make our healthcare system better and more sustainable for our patients and for our colleagues?
I believe that working together, being in that team-based patient care is the real and genuine way to build a sustainable healthcare system that brings joy, because I always have to speak on the joy, to the practicing clinician. And that's what I stand behind in my consulting business, Aligned Care, when I work with collaborating providers. The only way to be sustainable is working together, because when we do work together, we're able to understand each other's pain points. We're able to see how we can come up with a solution, and we're able to be in sync with taking care of our patients.
I want to pause for a moment to share something with you, my friend. After landing several non-clinical roles and coaching others to do the same, I have found that if you're running into roadblocks, making that pivot out of direct patient care, it's because of one of three reasons. One, you haven't quite figured out what you want to do yet, and that's okay. But take the time to dive deep to figure that out. Number two, your resume screams clinician. And number three, you haven't demonstrated value and impact in your current role. Regardless of which reason resonates most deeply with you, I'll share some resources to help in the show notes section of this podcast.
You said something powerful about, joy in our work, or doing the thing that brings us joy. And I feel like a lot of clinicians are not in that space of joy right now.
Yeah.
So what advice would you give them?
I'm glad you brought that up, and correct me if I'm wrong, but personally, I feel like the joy was already ready to tip over, but the pandemic just pushed it to another level.
100%.
Yes. And with my consulting business, which I'm repeating this because I work closer to other healthcare providers in this business more so than in with the patients. The pandemic was really that defining point for me to notice that the joy is slowly slipping away, even within our grasp. And my advice would be that although the system can be challenging, because that's why it's no longer joy. The system can be challenging for most clinicians in navigating the patient care that they usually would enjoy. Although it's challenging, it's best for the clinician to really step back, and instead of enduring these challenges into a burnout, it's best for them to just step back, figure out exactly what's the root of that challenge, what's the source of it, and pivot. It's scary, but pivot and figure out the right group of people that can support you on the next step. And I think that's why we're seeing a lot of virtual practices that are coming up, because they're becoming a little more individual on their own to be able to care for their patients the way they want to. But most others are scared to do that because they're not sure of the support. They don't know how to begin. So seeking the mentors, looking for support, and just moving forward with the type of patient care that you want to provide, rather than enduring yourself into a burnout.
Where did you find your support and your mentorship?
Honestly, my community within was how I figured out that, I can never do this alone, especially during the pandemic. I provided a webinar. That's how it started. The pandemic, I provided a webinar to gather the information to help them just share the information and the misinformation that's out there, for patient care clinically and non-clinical clinical aspect of patient care during the pandemic. And after that, I was really shocked at the interest of those that showed up to the webinar. And I think that really opened the door for more consulting into the virtual space, because with that, people started reaching out. And it wasn't just me providing information to them, they were also supporting me and helping me understand what pain points they were on their end. And I was also able to share my own pain points that was helping them. So it was very mutual.
So pre-pandemic, because back in 2014 is when you actually started the discount pharmacy, right?
Yes.
And then you're saying during the pandemic is when you switched to consulting?
So pre-pandemic, we started the pharmacy. And with that, it was more geared towards the patients. But being in a community, the providers were also able to just reach out to us and ask us questions without any issues, you know. But during the pandemic, it was more challenging for the providers to understand the different options that are available, how the patients can get access to those care and what they needed to do, the steps financially, how the patients are able to afford those care, because those care options were also changing rapidly. So no one could really keep up. So during the pandemic, I made the decision to after the pandemic, I made a decision to completely move my care for healthcare providers into a consulting business of its own.
Okay.
Right. Individually into a consulting business of its own. But prior to the pandemic, though, my consulting aligned care was active, but I was also working 1 day a week at a family care practice. But it was more like a medical practice, embedded myself as a pharmacist there. But I think this is just getting confusing. But I think during the pandemic, it was now individualized. Like I could really help anyone. You need questions or you need answers. You need help with solutions on your patient care. You can definitely reach me here.
Right. So the consulting side is really working with the different providers and on how they can take care of their patients and the questions that they have, as opposed to working directly with the patients as a pharmacist that's filling their prescriptions.
Exactly.
Okay. So you have a greater opportunity in your current role as a consultant to really lead the charge for other providers and the patients that they touch.
Definitely. And in my role as a consulting pharmacist, I also want to encourage providers that are being challenged with their own patient care to reach out, because that's how I'm able to reach providers that are being challenged in their own section of the world, caring for their patients. Because healthcare is so complicated and it's every day it keeps changing, from options to prescribe to cost of the medication, access to it, how patients can navigate the healthcare system. It's just not a one size fits all. And I don't understand how a provider or a clinician is able to navigate all that along with taking care of their patients and documenting all the encounters they have throughout the day.
Yeah, and I think the pharmacist provider relationship is crucial because it helps prevent medication errors. There are so many things that can go wrong.
Yes.
Between the decision to prescribe a medication occurs and when it's actually filled by the pharmacist and given to the patient. There's a lot of things that happen in between that a lot of people probably don't realize, but it's very error prone and it takes a lot of skill and diligence to prevent those errors from happening.
That is true. And that's just one aspect of it, because even when you navigate yourself out of that maze, now you really have to worry about, can the patient even afford this? Or should we have been looking at the other options? Or sometimes the providers are not even sure of which other options are available, like currently in the market. I mean, at the moment, there's so many drug shortages that there's no telling what's available and what's not. So it almost, like I tell my providers, it's almost like we have to have a plan A and a plan B.
Yeah, because it's access. I mean, you said it, it's access to care too, right?
Mhm.
When someone has to choose between paying their rent or their mortgage and picking up their prescriptions,
Yes,
right? Because of the cost of their prescriptions, that's a choice that someone shouldn't have to make, right?
exactly. Yes. And most people, that's just the way they live, sadly. And it's unfortunate because it's having to choose between your rent or your medication. Of course, you need somewhere to stay or have a roof over your head, but it's easier for them not to go with the medication because guess what? At the moment, they're feeling okay. So it's maybe next month we can get the medication or get the chance to accumulate money to get that medication. But that's what we don't want because that's how we start moving backwards from progress that we already achieved.
So, how do you help the providers with that? How do you help with that literacy or with that being able to afford patients being able to afford their medications?
Yes, that's a good question. I'll give you a good example on that because just to make it practical, I think it was 2023 last year. The government had this cap on insulin, and
Mm-hmm.
it's like insulin cannot be more than $35 per month. And we were all excited about that because, Brandy, I would tell you, there are so many people that need insulin to survive. But when they get into that donut hole that they cannot afford it anymore, when
Mm-hmm.
it becomes 150, it becomes a real problem. Like it's one of those decisions they have to make. So when there was the cap of $35 a month with insulin, it sounded good. Providers were happy, pharmacists were happy. However, the truth behind that cap is $35 a month. So when a provider writes for an insulin administration daily, and it comes in a box of 5 pence. I'm not going to bore the audience, but it comes in already prepackaged form. And with the prepackaged, depending on how much insulin a patient is using daily, that pack can last for more than 30 days. It can actually last for 90 days, 100 days, so over maximum of 90 days, right? So if they're injecting something like 10 units a day, that whole pack definitely it's going to take them to over 90 days. Well, if you cannot break that pack and you have to dispense the pack alone, that's 35 plus 35 plus 35. So let's do the math.
Oh, oh my gosh.
Yes. So it was so unclear, and my providers would ask, I don't understand, but the rules. And I had to tell them, I had to repeat this example to them, and then I have to advise them, listen, the best way to write this is use it, like let's say that 10 units daily up to 40 units a day, right? So now when a patient is getting their insulin or a pharmacist, whatever pharmacy they use, is dispensing that insulin, they have to account for the maximum daily use. And that would bring the day supply less than that 90-day supply. And no, that's not an insurance fraud because patients within that 90 days, their dose can also change. And then when the dose changes, they already made the decision to gather money somewhere and pay over $100 to get the insulin. And now it's changed where it could have been written correctly. So there's a lot of non-clinical knowledge that's needed to take care of patients and make sure that the patient is taken care of the right way.
Yeah, because you're trying to make sure the patient is taken care of from a health perspective, but also from a financial perspective, because
Exactly.
it doesn't do any good to have this medication if you can't afford it or if it runs out before you can get the next one or all of these things that can be barriers to
Right.
wellness or safe patient care.
Right. And a lot of times understanding how to prescribe those well, most of these medications correctly is just with experience, to be honest with you. So for the providers that haven't had that much experience, they may not, you have to make mistakes to learn. So they haven't made enough mistakes. It's just when I became a pharmacist, I had to make many mistakes and realize, okay, that's at this point, this is how I should navigate this position or this situation. And I personally think everything is figure outable, if that's a word. But these new providers or even veteran providers with changes like this, they don't need to wait for the experiences of, having to have their patient go through all that issue before realizing, okay, we can actually do it this way. That's why we're here. And that's why I'm here. That's why the consulting business is, it's active, like there to help out.
That makes a lot of sense. That's why they need a pharmacist on their team.
Yes, that's why it really is a team based. Like we can't. It opens up the way to see how that medical site operates or how pharmacy site operates. And another example here is like prior authorization. It's every day. There's always a prior authorization that the insurance that you have to honestly navigate. And most providers or most clinicians are tired, and pharmacy too. Pharmacists are. And it just comes down to just knowing those triggers and knowing how to have less of those issues arise to contribute to the challenge or administrative challenge that you're already having with taking care of your patient.
Yeah, healthcare is so complex, and you're right. It does take a team approach because none of us can know everything we need to know about a specific topic. We need the other discipline to use their expertise so that we're working together instead of us trying to know everything there is to know about how to take care of a person, because we are 360-degree humans and we're complex, and that's why healthcare is complex.
That is true. And I have to say too, even as owning my own pharmacy and as a pharmacist, and for the audience that are pharmacists, they would also agree with this. A lot of the things we know especially in outpatient, this is specifically in outpatient practices. What we know in outpatient practices is really what we learn as we're doing the work. These things are not necessarily taught during training. And if it is, it's usually during the internship of like 1 month, and then you move forward. But once you're out, you realize, okay, everything I know right now is about pharmacy, but the truth is taking care of your patient like you want to is not just through pharmacy. There are other means, and just understanding how the medical side of things work it's what's going to help us have a sustainable healthcare system.
Awesome. So how can people connect with you?
Well, of course, LinkedIn. I'm always on LinkedIn, and definitely they can always reach out online at www.alignedcarellc.com. That's a consulting business. Or if they want to learn more about our independent pharmacy, that would be at www.southsidediscountrx.com.
Awesome. Well, I'll put those links in the show notes for people to just click on and find you. Thank you so much for joining me today for this conversation. I have appreciated learning about your journey and having you share that with my audience.
Oh, definitely. Thank you so much, Brandy, for having me. And I'm glad you had me as your guest today. Thank you very much.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.